Welcome to Season 5 of My Wife the Dietitian, a fun, evidence-based weekly podcast about nutrition and healthy living. On today's show, we are joined by Dr. Dean Elbe for another installment of Ask the Pharmacist. We'll be talking to Dean about a variety of different drug and nutrition interactions. Stay with us for all the details. Enjoying the show? You can help others find it and enjoy it too by giving us a 5-star rating or review. If you feel like reaching out to us with a question or comment, you can send us an email at mywifetherd@gmail.com. And don't forget to visit our website at mywifethedietitian.com, as well as our social media pages. We're on Facebook, Instagram, and YouTube. Enjoy the show. Welcome to My Wife the Dietitian. Hello, Sandra.
Hey, Rob.
How's it going?
Good. How are you?
I'm doing well.
Good. We got Dr. Dean Elbe, a pharmacist.
Oh,
Ask
that guy.
the Pharmacist.
That guy's back.
Yes, we
The
love
guy-
this segment.
The guy with all the answers.
Yeah, he knows a lot.
He sure does.
Wow. Yeah. So we have 2 listener questions plus one from you, actually,
Yeah.
that we're going to...
I've always got questions.
You do.
Well,
Yes.
especially on this kind of show, because there's so many things that I don't understand. So I got to put my hand up and find out.
It's awesome to be able to pick his brain. Thank you, Dean, for coming on the show. This is the 4th time with us. So this is really, really great for the listeners too, to hear all about drug nutrition interactions.
Exactly. So, stick around. We'll be right back with Dr. Dean Elbe.
We have Dean Elbe here, Ask the Pharmacist, and we'd love to talk to you, Dean. We have some questions for you today. Can you just let the listeners, in case there's new people that haven't tuned into our previous episodes with you, because we've done 3, could you tell them who you are and who you help, what you do?
For sure. Hey, great to be back with you, Sandra and Rob. I'm a clinical pharmacist in child and adolescent mental health, and I've been in practice for coming up on 34 years this year.
What?
1992. So yeah, that's 34 years if you count it back.
And we worked together in 97 at Richmond Hospital.
Yeah,
30 years
exactly.
ago. Oh my God.
Yeah. And since then, besides my day job in child and adolescent mental health, I run the Drug Nutrition Interactions website, which is a platform for dietitians and other healthcare professionals to make sense of the complex interplay between medications and nutrition and how they affect each other and how to monitor and appropriately manage nutritional impacts of medications.
Wow.
Yeah.
That's awesome. That's so
Super
comprehensive.
helpful.
Yeah. I love your website. It's amazing, the information on there, and it's continually updating, because all these things, medications are constantly changing.
Continually updating. I literally applied a update yesterday with 4 new medications approved by the US FDA and over 40 different warning and content updates for other drugs. So it is constantly updated, and it's something you can't do with a printed resource. You can only do it with a live resource like drugnutritioninteractions.com. And to keep it maintained and up to date with all the new medications just is going to help dietitians to stay up to date. Things change so rapidly now.
Oh, absolutely. I used to have the handbook, when as a clinical dietitian for 30 years, I used to carry that handbook with me when I did consults through the hospital halls and wherever I was working. And it was such a great resource. But like you said, there was edition after edition after, 18, 20 editions or something.
Yeah, we got to 19 before they packed it in. Yeah.
Oh, okay. Yeah. Yeah. So the printed resource was amazing. But like you said, it makes sense to have it online where you can constantly update it weekly, right?
Yeah, and you don't have this thing in your lab coat pocket, although who wears lab coats these days, but you don't have to carry this book around. You have it with you because you have your phone with you everywhere you go now. So you have DNI with you.
That's right. Oh, what incredible. I think So many people thank you for what you've built, and it's such an important piece of the, helping clients with their nutrition, the diagnosis, the medication interactions, what our nutrition care plan will look like, are their goals, the outcome, all that. Like it's such a important resource, and we thank you.
My pleasure. And, virtually every client you see is going to be on a medication at this point these days, right? So if not several. So making sense of those gets more and more complex, and knowing you've got an up-to-date resource with you is going to make that job just a little bit easier for you.
Absolutely.
Yeah, because it's not just prescriptions. It's over-the-counter medication that you look at too, right?
Mm-hmm. Yeah, for sure. We do include over-the-counter medications, and then the interactions between prescription medications and natural health products, supplements, natural medicines, and things like that can have clinically significant interactions with prescription medicine.
And like herbal remedies and things like that. Yeah.
Think of those commercials for, I don't know, where they're talking, they have to fit all the warnings in their 30-second spot. And the guy's like, may cause, blah, 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 blah. And he just rhymes off like 80 different issues, the interactions. So
that's an American style ad too that you're seeing. Of course, they speed up, and then they show like the imagery while the side effects listing is like people walking on the beach, and it's all pleasant and idyllic while they're listing off all these potentially harmful effects.
I know, right? May cause death, blindness, like limb displacement, and they're like, yeah, but we're good. It's all good. No worries here.
You'll feel much better.
I'll have to dig one out. It was an old parody of an antihistamine ad, but like they're listing off the side effects, and like one of them was may cause the condition known as hot dog fingers.
What?
Just makes me laugh. I'll see if I can find it. I'll send it over to you. Maybe you could post it for your listeners.
That's hilarious. Hot dog fingers.
Yeah, let's do that. That's a great idea.
Oh, man.
Oh my god. Oh my gosh. Wow. Yeah, that's oh my goodness. That is so funny, Rob. That's funny that you said that. The guy's almost like an auctioneer the way he's speaking.
Well, it just seems to be so counter productive as far as the purpose of the ad, because they're trying to sell this amazing product, and then they finish by telling you all the bad things it does. It's like,
they have to, right? The FDA makes
absolutely. Absolutely. But I'm like, well, who wants to buy it now? All these things that it's going to do potentially. I don't want to take that.
Oh my gosh, funny. I'm sorry. That's just so funny. I just I had the image of like Viagra or something.
Well, yeah, me too.
Heart attack, death.
Yeah.
Oh my god. All right, we have some questions from different listeners, and last time we talked to you, I think it was like in December, episode 207, Food and Meds, with pharmacist Dr. Dean Elbe, and we got through 2 of our 4 questions that we were going to ask then. So I had to, delay and re-ask you these ones because I still want to know, and so does the listeners. So, so the first question is, what about my caffeine intake with coffee, tea, soda? Can it trigger hot flushes or interact with anxiety medication?
Oh, interesting.
Yeah, such an important question, because I was just reading as I was doing a little research before we came on. One stat I saw said 85% of the North American population consumes caffeine in some form, which is an interesting stat. So it's very likely something people are taking on essentially a daily basis. And important to think about the hidden sources of caffeine too. So there's the obvious ones like coffee, tea, and some of sodas. Of course, energy drinks that have become very popular. And the main source of energy in energy drinks is caffeine. Sometimes it hides by other terms. You might see it as guarana or mate. So it's kind of a hidden way.
All right.
But sounds more natural, but it's still caffeine.
Yeah, caffeine is caffeine, right?
Yeah.
It's like a chemical structure. It's okay.
Yeah. So that can hide in different products as well. But in short, yes, caffeine can trigger hot flashes in women in perimenopausal time frame. There was actually a study of this. This is about 10 years ago now. A study at the Mayo Clinic found that caffeine, due to increasing heart rate, can increase your core temperature as well. And that action can trigger hot flashes and night sweats. And it was actually in this study significantly associated with increased menopausal symptoms. And if you think about like a lot of the weight loss agents and things like that rely in part on caffeine because they're thermogenic. So they burn calories essentially, and that increases your body temperature. And so, yeah, if you're experiencing vasomotor symptoms of menopause, you may want to reevaluate caffeine intake during that time, or especially like at night, if night sweats are a particular problem. Also, that caffeine too late in the day can also affect your ability to fall asleep.
Because isn't the caffeine half-life like 8 hours? Like there's only in 8 hours, only half the caffeine has left your body. You still have half of it still there.
I looked at it recently. I thought it was like 6, but 6 to 8 hours, something like that. So I always thought about, is there a way to have a caffeine antagonist? But it probably wouldn't, just because its effects in the central nervous system are so widespread.
Yes,
it probably wouldn't be easy to make. So officially up to date says the elimination half-life for caffeine is 5 hours. So there you go.
Okay.
I think the antagonist is called decaf. They just cut it out at the source.
Funny. Yeah, right.
The other aspect I mentioned was effects on anxiety medication. So couldn't really find that it alters the blood levels or the metabolism of anxiety medication. That would be a pharmacokinetic interaction. I think we've talked about this on previous podcasts about the different types of interactions. But what more could happen is more of a pharmacodynamic interaction. So caffeine can worsen anxiety symptoms for some people, especially those that have a lot of we call somatic symptoms or body symptoms. So that can increase your heart rate. You can get jittery, and that can feel like anxiety to people that are very sensitive and alert to how their body sensations are. I mentioned difficulty sleeping at night, and if you don't sleep well, you're going to maybe feel more anxiety symptoms. So it's more of a pharmacodynamic interaction with anti-anxiety medications than anything affecting like how the anti-anxiety medication works and is eliminated.
So it's like a vicious cycle. Like if you're feeling those symptoms and then you're jittery and then maybe you're having problems with like insomnia or difficulty sleeping, and then you wake up and then it's actually magnified because you didn't get the sleep you needed. So you're feeling anxious. And so it's kind of like this vicious cycle. It just kind of feeds in on each other. Okay.
Yeah. And this is another website I manage. It's called drugcocktails.ca. I think we've featured it before.
Sounds familiar.
So this is drugcocktails.ca, and it's to help people get the facts about the risks of mixing prescription medications and substances. And caffeine is classified as one of the 10 different substance classes that we cover in drug cocktails. So it's a free resource. We created it for youth. But professionals also use it, and caffeine is one of the categories. So if you're interested in caffeine and how it might interact with your medicines, drugcocktails.ca is a great free resource for people to look at.
Oh, that's a really interesting name. It's a good idea.
As my colleague wrote a book probably 25 years ago now called Cocktails, and it was the early version of this in print again.
Oh yeah, right.
which made it, she says, I want you to update this, and I took it online as well. So drugcocktails.ca is the place to go for that.
I'm sure you get lots of hits with that title too.
Yeah.
What's this about?
Yeah, right.
Sounds interesting.
It's fascinating to look at the analytics. It's not just BC, it's all over the world that is finding and using the site. So
right.
I bet. Gosh, there's so many amazing resources that come out of Canada, like and that's local, like BC, like your friend did it. That's really cool. Like I just noticed a lot of amazing resources, and they're coming out of the Great White North.
Yeah, well, we excel at communication, right? We have this great big country, and being able to communicate is probably why we're so good at it.
There you
Oh,
go.
I like that. I've never actually considered that aspect. You're right.
Yeah, there was it was an editorial in Maclean's a few years ago, and like sort of what defines Canada, and their conclusion was communication nation. Like that's our strength. That's our, we have lots of strengths, but that was our one sort of defining strength, is we are the communicators, and probably why so many actors and comedians and media people come from Canada, and all our resources, I think, again, just having to function in this country that's so spread out, yet we're able to stick together. So it was an interesting editorial.
Wow.
Yeah, that's an interesting perspective.
I really like that. Yeah, that's
hockey and communication.
That's right.
Yeah. Question for you, Dean, about the caffeine. Was there quantities that were sort of suggested in these studies, or ones that you've sort of looked at yourself, as far as how much coffee someone's drinking or caffeine intake, I guess?
In the hot flash study, I don't recall offhand. I think they probably just classified somebody as a user or not user.
Right, I see.
But I don't recall the actual quantity offhand. Typically, we'd say 100 to 200 milligrams would be a significant amount of use. You'd find that in 1 to 2 cups of coffee.
Okay.
Yeah, and then some products give you much more.
I guess it's good to know. I mean, if you are someone experiencing these symptoms, it's like, okay, well, coffee could be, has been shown to be related. So maybe that's something I could try to, change and see if it helps.
Yeah, absolutely. I think that's a great idea. And also we know that there's genes related to how if we have the enzyme in our liver to clear the caffeine out of our bloodstream. So if you are someone who doesn't have that, you might be someone who's, the caffeine builds up, or like it's not cleared as easily as someone who clears it. So that, I think there's individual genetic differences too.
Yeah, exactly.
So, yeah. Okay. Okay. Got another question. This is from another listener who has a family member. So my older mom has been taking bisphosphonates for 2 decades. Is this safe? And what are the side effects or implications for long-term use for bisphosphonates?
And can you explain what they are?
Oh, yeah, maybe. Yeah.
So bisphosphonate refers to a chemical structure. This is a chemical class of drugs that is used to treat osteoporosis, or fragile bones that develop with age. So they've been around for probably 30 years or so now. Very commonly used by people at risk for osteoporosis, and it's a long-term preventative kind of medicine. So these drugs, when you take them, they actually get incorporated into your bone, and they stick around in your body quite a long time because of that. And they change how your bone, we call it remodeling. So your bones are constantly breaking down and building up, and these medications help promote the building up part and slow the breaking down part, if that makes sense.
Nice.
To change bone remodeling and eventually increase bone mineral density, or BMD, which is the measure that we'd look at if we were going to evaluate, how at risk you are for osteoporosis. And of course, having fragile bones with lower bone mineral density could put you at increased risk for fractures and breaking those bones in a fall as you get older, or if any kind of physical trauma. So they have studied these medications more long-term than most medications, because they do stick around for such a long time. Studies run sort of up to 8 to 10 years in duration. Overall, yes, they are seen as relatively safe medications, but there's a couple of points here that, especially as people get older, and if somebody has mobility problems, you need to make sure that they are able to sit or stand upright when the medicine is taken and for at least 30 minutes afterwards. So you don't want to have the situation where somebody takes their medicine, they sit up, take their medicine, and then lie back down again, because that can lead to the medicine staying in the esophagus, and it actually can cause inflammation of the esophagus if it's not sort of deposited into the stomach and absorbed in the stomach and the intestine. It can irritate the esophagus and lead to a lot of gastric distress. So the recommendations are to make sure you take it on an empty stomach with water only. Because it is very poorly absorbed, you have to sort of do what you can to optimize its absorption, and then make sure you wait and stay upright for 30 minutes and don't lie down until after you've had food.
Wow.
To prevent that from happening.
Oh my God.
So that's one aspect.
Okay.
With the bisphosphonates, usually these are medicines you take once a week, so it's not every day.
Okay.
Sometimes they're once monthly, depending on the form. That's one safety aspect as people get older. And the other aspect is that there can be, while it lowers your rate of sort of standard, if you will, fractures from falls and things like that, there can be what we call rare atypical fractures. So this could be a fracture that happens with without a trauma, essentially, or very light, you bump something and it can lead to a fracture. So this is an atypical fracture, and it slightly increases the rate of those atypical fractures. And especially also worth noting that if there's any invasive dental work planned.
This is where I was getting to. Yeah.
These drugs are associated with what we call osteonecrosis of the jaw bone. And so you want to have that conversation with your dentist or oral surgeon before any invasive dental work is undertaken, because there can be the risk for that occurring.
And I've seen it. I've seen it in long-term care.
Yeah.
Yes, I've seen a woman who has been on bisphosphonates for, over 20 years. And the GP was like, okay, let's take her off this because her jaw was affecting her jaw basically.
And what happens?
Was it after a dental surgery or was just on its own?
Yeah, I think it was after the implants. Yeah. And Rob, are you wondering what necrosis is?
It sounds like it breaks it down. Is that kind of what it means?
Yeah, like necrosis is essentially death of the cells.
Right.
So
okay.
it's necrotic or not a live bone, essentially.
Even though it's designed to help strengthen your bones?
Yeah.
Long-term use, though. It's not real. It's a bisphosphonate that is like as Dean said, it goes into the bone. It helps remodel the bone. It's part of the bone, but it isn't bone, right?
Yeah.
Okay.
Yeah, exactly.
Interesting.
And, you may start taking it 20 years ago and then break a tooth on a chip or something like I did a few years ago and end up, I need a dental implant now. Right? You may not have been intending to have dental work when you started this medicine, but then it becomes an issue. So you have to have that conversation with your oral surgeon about the risks and benefits with that if you're taking a bisphosphonate or have taken a bisphosphonate in recent years. So those are probably the two main long-term things to be aware of. And interestingly, some guidelines do suggest that depending on bone mineral density measurement, depending on an individual's risk for fractures, sometimes they will look at doing what we call a temporary drug holiday after 5 to 10 years of bisphosphonate treatment. And so that's some people at low risk of fracture, they might come off of the medicine. Others at higher risk might interrupt treatment for a year or two, but it really depends on your individual risk when to make that decision. So you would need to discuss with your doctor about the risks and benefits of interrupting it, how well you're tolerating it, what your bone mineral density measurements say, and make a decision based on your individual risk.
Yes. No, that totally makes sense. It's, it's amazing how the side effects for long-term use, I mean, these are handy and helpful for people with osteopenia or osteoporosis and preventing, the further degradation of their skeleton. But the long-term use can actually like do the opposite, like actually, eat away at the bone. So, and especially in the jaw.
But it's also balancing, the benefits. Most people get an improvement in bone mineral density and a reduction in fracture risk. Atypical fractures and osteonecrosis of the jaw are rare adverse effects.
Right.
So your overall chance of benefiting and risk of these side effects is low, but it's not zero.
Yeah.
And you need to be aware of that when you're taking these medicines.
And this is why I really encourage people to be very conscious when they're young, like their kids and their teens and their young adults, to get the calcium and vitamin D and get the exercise and make sure that you have a strong skeleton starting out in your life. So you don't have to take this
around age. Yeah, it's around age 20, if I recall, Sandra, that sort of pegged as when bone mineral density peaks, right? And it's important to build that up to its peak.
Yeah,
in your teenage.
That's young.
Teenage year. Is that age 20, right? I think that's
you're
correct.
right. You're right. It's like, it's so young. Like, it's basically, osteoporosis is a childhood disease that doesn't develop. That's what I say in the grocery tours, because I don't know, a lot of people are off milk, or they just don't like dairy products, or for whatever reason they just have decided to not.
I think TikTok is the reason.
Maybe. Yeah, but it's like, this is like a good source of calcium and vitamin D, guys, and protein.
And it's often pegged as like a trigger for allergies or asthma or immunological or rheumatological symptoms.
Yes.
But it's important. And, when you're 18, you're not thinking about your bones at 70 potentially, but you should be.
Exactly. Totally.
Yeah. That's the time, right?
Yes. Yes. Oh, I know. It's
And then when you do become concerned about it, then it may be too late to build that bone mineral density reserve. You can take calcium and vitamin D, but if you're well past your peak, it's not as effective as building that strong peak bone mass at a young age.
Yeah. Nutrition is so critical, like it's such a important, like it's our day-to-day living of what we're eating, what we're, our habits. And, people get in these habits and they keep them for decades. And then I see it in long-term care. I see the women that have come in and they are no milk, they're lactose free, they don't like milk products or whatever. And it's hard to get enough calcium and vitamin D if you are cutting out a whole food group like that, in my opinion, because I've seen it. It's hard. Like you have to be very conscious about what foods you're choosing and be like strategic. Okay, this is good for bone health. But if you're cutting out like the whole food group that really offers easy source of calcium, protein, and vitamin D, then it's a battle. Like it's like pushing a boulder up the mountain.
Yeah. Yeah. And you saw for a while, I think it's less popular now, but you saw a lot of calcium fortification of juices and some other foods as an attempt to provide an alternative source, but I don't see that as much anymore. Walking my grocery store aisles as I used to.
Yeah, that's interesting. I don't know. I mean, the vitamin D is a key part of it. The exercise. I mean, we all are becoming more sedentary, getting the sitting disease, not moving our body, not using like weight-bearing exercises to help strengthen our bone and our muscle. So these things all take a toll on our body over decades. So anyways, okay. We got another question. I think there's one from Rob. He's asking something about
from me.
Yeah, you were asking this morning. You said something about
another Rob.
Your mom is taking iron and doesn't know if she needs it anymore. And
Oh yeah. So my mom had a bleeding ulcer back in November, and they gave her iron supplements just to counteract the bleeding, and she's still taking them, but because no one's told her not to, and she's wondering if she still needs to take them. And I said, well, you probably need to just check your blood work, but because you can get too much iron, I would think, if you're taking supplements that you don't need to be taking, right?
You can potentially get iron overload.
Okay.
Yeah. Depends. There's a variety of supplements available with different levels of iron content in them. Hopefully the bleeding has stopped, and they found whatever the source.
They found it back in November, but she's just taken her pills because that's just what was prescribed back then. It's just an over the counter. It's like I think 50. Does that seem right?
Oh, I mean, there's so many formulations. So many different salts with different strengths, and so the way I agree that periodic checks of blood work, you would look at your red blood cells, hemoglobin levels, but also your iron stores and your body's iron total capacity. So usually the test for that we'd look at is the ferritin level, which is a measure of body iron stores. And if she's no longer anemic with a low hemoglobin, iron stores are adequate, she could reduce or stop potentially. Again, with her doctor's advice, but having that checked is worthwhile. After 6 months.
Dean, I think you and I should formulate a multivitamin that is targeted for elderly women who need iron, because most of the seniors multivitamins out there have no iron, because technically people don't need any extra iron when they're older
because they're not losing blood.
Yes,
because they're
so many elderly women that I have consults with, I actually get them to be on a prenatal because it has like 14 milligrams of iron, so it's like the biggest dose of iron in a multivitamin. But they're always like, "Oh, but I'm not going to have any kids." It's like, why don't they make this? Like, I don't understand why there's not like a formulation out there that, why? Like, it's obviously it's happening for people that they have anemia for whatever reason. But anyways, so just something that I was like, they should develop one, or maybe we should. But anyways. Yeah, I don't know. Do you see that? I guess you worked with children.
I mean, there's what was there? Centrum Silver. Is that still a product?
Yes. I'm pretty sure it doesn't have iron though.
Okay. Yeah.
Yeah. It's basically the iron is in the women's formulation up until 50. So like the age 19 to 50. So there's a little bit of iron in that. And then the prenatal has like the bigger dose of iron.
The bigger dose.
Yeah.
Makes sense.
Yeah. And then the seniors, men, there's no iron usually. And in the seniors, women's, there's no iron. But it is a tricky.
Yeah, we should.
It is tricky because it's like, for a lot of people, they don't need to have a supplemental iron. And it's probably actually a negative thing, especially for men, right?
Well, iron's not free of adverse effects, a small amount, but I was just looking up the label. So Centrum's Women 50 Plus in Canada contains 6 milligrams of ferrous fumarate.
Oh, okay.
Not very much.
Oh, interesting.
So it's a little bit,
okay.
A smidge.
Yeah, right.
Yeah,
right.
That's a smidge. Like if you're going to take supplemental ferrous fumarate, you'd have 300 milligrams, of which like 100 of that would be elemental iron. So
okay.
Your elemental iron, this is like about 2 milligrams of elemental iron, which is not very much.
Okay. Oh, interesting.
Yeah, so there's a whiff of iron in women's 50 plus Centrum.
Right. Okay. Yeah. Interesting. Okay. No, that helps with, there's a lot of discussion about iron. I do a lot of prenatal groups too. So there's a lot of women who are anemic or have low iron. So it is a discussion about, the best, absorbable sources that don't cause a lot of constipation or other GI issues. So yeah, we're always like looking for kind of the best sources of iron.
Here's another little tip. If you are taking supplemental iron, most forms are improved by using a small amount of vitamin C, either as juice or as a tablet of vitamin C.
Yeah.
It actually improves absorption of iron. So that's a drug nutrition interaction, like a physical interaction that actually happens in the gut.
It's a positive interaction.
A positive interaction, yeah. So harness it.
Yeah.
Like
I even know that, Dean. We've discussed that many times. Sandra quizzes me on that often. So I've learned that it helps your body absorb it when you eat it with vitamin C. Yeah,
I knew that I was hoping that Rob, you would chime in there, because I'm sure after all the different episodes we've done about iron and iron deficiency and how to, maximize your absorption in a meal, you knew about the vitamin C.
I did. Yeah. It's like, I know this one.
That's right.
I gotta chime in where I can here to keep up with you guys.
That's awesome. Oh my goodness, that's great. And I think we have done other episodes. Episode 178 was "Does Diet Affect Medication?" That was with you, Dean. And then episode 184, "Ask the Pharmacist." So we had other listener questions. I have a few pages of questions, but I want to be respectful of your time. And I think what we'll do is maybe get you back on the show in the next few months, and we'll continue the conversation with other questions and just the banter. It's so much fun to have you on the show.
We always have a great time when we're having a chat here. Yeah, I miss it. So happy to come back and talk all things drug nutrition interactions on future podcasts.
Yeah, that's awesome, Dean. Thanks so much for joining us today. And we'll link your website. Just give it a shout out now. It's DNI.
Yeah, DNI. It's drugnutritioninteractions.com. This is a web app.
Perfect.
It's by subscription for professionals who work in this area. And the other one was drugcocktails, all one word, .ca, which is a free app it's a web app again that anybody can use to look at medications and substances interactions.
That's fun. Not to be confused with like a party planning app.
No.
Well, I mean, I guess you could, but ideally not for that use.
Just like a drug holiday is not to be confused with a trip to Jamaica.
Yeah, well, I was wondering if the drug holiday was connected with the drug cocktail website. So
that's so funny. It's funny that drug, like the word drug, is the same. It means the same thing as medication, but it also means the same thing as many other things.
Yeah, so the context of that one word.
Totally. Oh my gosh.
We're all taking drugs.
Right. We're all on drugs at some place or another. Caffeine is a drug. So yeah. Oh my gosh. Well, this is great. Okay. Well, Dean, we will get you back on the show, and we really appreciate the time that you spent with us this morning.
Thanks, Sandra. Thanks, Rob. Great to be here anytime.
Okay.
Yeah. Thanks again, Dean.
That was such an interesting conversation with Dean.
Always.
I loved how he talked about like Canada excels at communication nation.
Yeah, interesting point. I'd never heard that before, but it makes a lot of sense.
Yeah, with how like the Great White North were so spread apart, and yeah. But I mean, in terms of the questions from the listeners and going over the bisphosphonates and how it can, has these rare side effects, but they do happen. I've seen it in some clients.
Yeah, that's interesting that you said you'd mentioned that you'd seen it.
Yeah. And yeah, he just has so much good information about anything we throw at him, which is so cool.
You know what I was thinking sort of the whole time you guys were, mostly Dean was answering your questions. Yeah. It's so important to ask your pharmacist. Like anytime now, it seems to be commonplace when you pick up your meds at a pharmacy is they say, do you have any questions for the pharmacist?
Right.
And they give you a big spiel about, okay, this is what you got to do with this. Like they used to just give you the meds and send you on your way.
Right.
But now there's, they're giving a lot more information. And I really encourage people to take advantage of that. Like I've been picking up medication from my parents lately, and I'm definitely taking advantage. I'm asking questions about like, is it okay if they take it with this other medication? And what about, do they need to eat it with food or without food? And, there's a lot of things that, the pharmacist isn't going to know your situation. Mm-hmm. So you got to kind of ask certain questions if there's certain things that you might be, curious about, and read the fact sheet that comes with it. Because there are, like Dean said, with most medications, there are side effects or interactions, potential, depending on everyone's situation. So it's good to understand that stuff and not just go, oh yeah, okay, here, I'll take that, and I'll, it's not Kool-Aid, like there are some serious things that can potentially happen with certain medications. So
absolutely.
And take advantage of that knowledge.
Yeah. 82% of people take some sort of medication. So that is a majority of people that are on medication. So
exactly.
And even like over the counter. So not that you might not have a prescription, but even over the counter medication. And as you said, caffeine is one of the biggest, most common, like in quotes, drugs that people use daily. So, that can affect other things in your body, like other medications, supplements, how things are working for you. So, yeah.
The other thing we encourage you to take advantage of as well is Dean being on our show. He's a regular guest on our show. He will be back probably towards the end of the summer, I would think, if not sooner. So if you have questions for Dean, I mean, he's the guy. He's written the book. He's got the website. He knows the answers to these questions. So don't be afraid to drop us a line and shoot us your questions, and we'll get Dean to answer them for you.
Yeah, and check out the website too. I mean, his website is drugnutritioninteractions.com.
I like the other one. I need to check that one out.
Drugcocktails.ca.
Yeah, that sounds fun.
That was interesting. They're both really good. I looked at them.
Okay, yeah. Right on. Well, thanks again to Dean for joining us today. We really appreciate his time and sharing his knowledge with us and our listeners. And if you have any more questions for us, like I said, feel free to reach out. You can email us at mywifetherd@gmail.com. You can also find some information about us and what we're doing here with the show on our website. It's mywifethedietitian.com. You can also find us on Facebook, Instagram, and YouTube. And Dean, once you listen to the episode, I guess you have listened to the episode by now, Dean mentioned a few links that he was going to dig up. He did send us those links, so we'll put them on our Facebook page and check the show notes. We'll add them there as well, so they're pretty funny.
The ones on the warning or disclaimer.
The hot dog fingers.
Yes.
Yeah, they're good. They're little parodies from the 80s or something like that. They're pretty funny. So yeah, give those a look. And if you're liking the show, let us know. We love hearing your comments and your feedback. It's all super helpful to us and keeps things moving forward here. And don't forget to share with your friends. Friends would like that too. So that is it for today. We will be back on Thursday with another installment of Nutrition Nuggets. So until then, have a fantastic week. Thanks for joining us today on My Wife the Dietitian. If you like what you heard, don't be shy. Leave us a comment or review, and be sure to share our podcast with your friends. If you'd like to hear more, hit that subscribe button. You can also follow us on our social media pages for updates, episode trailers, and other odds and ends. For more info and links on what we discussed on today's episode, check the show notes. We'll be back next week with another informative and fun-filled episode.